Welcome, everybody that's just joining us in. We'll give a few more seconds for people to join, and we will get started very shortly. So welcome, everyone. Welcome everyone to a very special speaker series of the Systems Innovation Healthcare Hub. My name is Anne-Marie Parent, and I'm a volunteer team member with the SI Healthcare Hub team. And I'll be the moderator for this session today, but you'll see it will be a very conversational speaker series. We are delighted to be joined by Dr. Mike Jackson. So Dr. Michael C. Jackson is an Emeritus Professor at the University of Hull and MD of Systems Research Ltd. He graduated from Oxford University, gained a Master's in Arts from Lancaster University and a PhD from Hull. And he has worked in the civil service, in academia, and as a consultant. And between 1999 and 2011, Mike was Dean of Hull University Business School, leading to its Triple Crown accreditation. Mike has been president of the International Federation for Systems Research and the International Society for Systems Sciences. In 2011, Mike was awarded with an OBE for service to higher education and business. In 2017, he received the Beale Medal of the UK Operational Research Society for a sustained contribution over many years to the theory, practice, and philosophy of operational research. And in 2002, he received the Pioneer Award of an International Council on Systems Engineering for the development of the foundation of systems engineering as author, educator, and intellectual leader in systems thinking. Mike is known for leading figure in the development of critical systems thinking, a topic on which he has published 10 books and over 150 articles. His latest book, Critical System Thinking, A Practitioner's Guide, was published by Wiley in July 2004. He is the co-chair of the UK Government Office for Science and Systems Thinking Working Group. In the next hour, Dr. Jackson will be sharing his perspective on how we can bring a critical systems thinking approach to address the issues in our healthcare system. The way this speaker series will work is Dr. Jackson will talk for about 15 minutes. He will make room for questions, and then he will talk for another 15 minutes, and then we'll make room again for more conversation. So what I encourage you to do is to keep notes of your questions that you might want to ask, or start posting them in the chat as he's talking, and we'll make sure to bring those into the conversation. And before we get going, I'd like to invite folks to just share, where are you joining us from today, just to see how much of the globe we are covering. But I have to personally say that I am quite excited to be joined by Dr. Jackson today. I'm almost done his book, but it's just anyways, I really appreciate all the components, and I'm looking forward to hearing your specific thoughts on how we can bring more of this thinking to address some of our complex issues in our health system. And so I think with that, I'll leave it to you to start us off.
Thank you. A lovely introduction. My head's getting a bit big though, and I hope I can live up to at least a small part of it in what I say. The topic is how critical system thinking can help address issues in healthcare. So I'm going to start by talking about issues in healthcare, and then go on to how critical systems thinking can help. So the first 15 minutes of my chat, and then let's make it conversational and lots of questions, lots of discussion, will be about issues in healthcare, and the second part about critical systems thinking and how it can address those issues. We've got a prima facie case for systems thinking, critical systems thinking, because virtually every major international organization, whether it's the United Nations, OECD, UNESCO, or the World Health Organization, always insisting that complexity is the main issue that they face, and that systems thinking is a way to navigate complexity. Similarly, the UK government, the Minister for Science, Patrick Vallance, is a a systems thinker, and the interest in systems thinking in the UK civil services is now massive. My claim to be able to talk to you about this is that I've been studying and using systems ideas for 40 odd years now. And I reckon I know what is useful in the systems tradition of work and what is not so useful. Not everything's useful, but a lot is. And I hope I can pin down that for you. So what issues arise in healthcare? I'm going to give an example of a health systems issue. It was actually the Ebola epidemic, which happened in 2014 till 2016 and impacted primarily Guinea-Bissau, Liberia, and Sierra Leone. But I think I hope what I've got to say will be relevant to health systems at all levels. So I'm talking broadly of a health system problem, but I think what I say will be relevant to groups of hospitals, hospital trusts, as we call them in the UK, to hospitals, and indeed to processes for handling cancer, heart disease, stroke, etc. I think this is of general applicability. So bear with it, and you can make the connections, I hope, to the area of health systems that you're interested in. So I'm going to talk about the Ebola pandemic in West Africa, which began in 2014. I'm able to do this thanks to the fact that I was very lucky. I had a PhD student at the time, Dr. Louis Sambo, who is an excellent person. And Louis was the regional director for the World Health Organization in Africa at the time, and led the local response to the Ebola outbreak. So he was right at the center of this thing. He'd had some sort of training in critical systems thinking at that time, but of course the thing was ongoing, a process, and he wasn't able to implement any of what we would now call the critical systems thinking approach or methodologies. Nevertheless, using critical systems thinking, he was able to reflect upon the experience he was going through at the time he was going through, as you can imagine, incredibly stressful. And what was clear was that the number of interrelated, interacting factors that were impacting the pandemic, the epidemic in West Africa, and the difficulties in managing them or navigating them. It was hugely complex. And the factors that were involved were of wholly different types. There were technical issues. There was no vaccine at the time for Ebola. There were no in-country testing facilities beginning, where you could take a sample from a patient and see whether it actually had the disease. Logistics were terrible in the country. There was a whole range of technical issues. Organizationally, these three countries at the very low end in terms of overall development, in terms of GDP, etc., and health infrastructures were exceedingly weak. Hospitals were already overrun with more traditional diseases and the other kinds of diseases that you get, malaria, etc., that you get in those countries that we fortunately don't have to deal with in the West. There were all kinds of social, cultural issues. In those countries, touching somebody who is sick is believed to take some of the pain away from them. So you're helping them if you touch them when they're sick. There were rituals around how you buried bodies. Women were responsible for washing the clothes of dead people, whether those people were men or women. The women got that job of washing the clothes. And there was considerable suspicion, dating back to colonial times, of health workers who came in from outside, from other places. So a whole range of cultural issues impacting what could be done. And there was actually violence against the health workers in some areas. There were political issues in that the three countries impacted all, of course, operated separately, but the borders were porous. People were crossing between them all the time. So there was no actual coordination. It was difficult to coordinate because you had to deal with three different political and health entities to try and do that. There were economic issues. The International Monetary Fund had been pressing these countries to put all their resources into economic development, which obviously they thought in the long term would lead to better improved health systems. But health systems had been neglected in that push. Mining was a major problem because it was leading to deforestation. Ebola is a zoonosis, a kind of disease that spreads from animals, fruit bats and monkeys, etc., to humans initially. And deforestation was making the habitat of the animals less large, and they were moving into other areas, and therefore coming more into contact with people. And there were ecological issues. Climate change was impacting where farmers could cultivate their crops, and they were moving more into the forests, and so therefore coming in more into contact with the animals as well to find cultivatable land. So a whole set of interconnected issues was involved. Imagine being confronted, as Lewis was, by that particular mess. Where do you start to unpick this particular set of interconnected problems? It's not really a health system, is it? It's a complete mess, a problematique, a swamp, a set of issues which you really don't know how to untangle, full of wicked problems. Whatever bit you unpick, it's going to start off something somewhere else. It's wicked in the worst sense. There's a whole set of causal relationships which infeasible to try and understand and to find ways of predicting what's going to happen. Whole sets of cultural issues, cognitive issues, people perceiving things differently, depending upon whether they were health workers or whether they were local people or whether they were governments or whether they were local representatives of the World Health Organization or central representatives of the World Health Organization, and all sorts of power relationships involved. A real complexity mess was involved. And Lewis was able to ask some insightful questions, do a lot of good work, but didn't feel that he ever had the tools or the knowledge or the approaches to deal properly with the horrible situation which he faced. So after that had happened and there was time to reflect upon it, he and I began to look what resources were available in health systems research. What was there that might have enabled the Ebola epidemic to have been prepared for better and to have been managed better once it had started. And here we came across what I see as some significant failings. There was if you look at health systems research, and Lewis and I published a paper on this, if you look at health systems research, you find that problems of this kind are called complex adaptive systems. It's not really a system at all in my view. It's a kind of mess, set of interacting problems, but it's complex interacting issues. You're dealing with that, but the tools that you have available for dealing with that mess are actually quite limited. So again, if you look through the health research literature at what systems tools are actually employed, then you'll find that there's only a couple of them that gain a lot or used a lot on the ground in practice. So you get process mapping to deal with, try to make processes more effective, and some of that worked in the Ebola thing. They were able to reduce the time it took to get results from tests from 6 days down to 1 day. Process mapping is widely used in the health systems area, and you'll find literature on that. And system dynamics is widely used, often well. There are system dynamics, there are articles using system dynamics to analyze the Ebola crisis. System dynamics has had success previously on with regard to polio, in deciding, once polio had largely been eliminated, whether you should continue vaccinating or only vaccinate when outbreaks occurred. It turns out to be more cost effective to continue vaccinating. It was system dynamics that convinced decision makers that that was the case. But these are two limited systems approaches which address only part of the complexity which I sought to outline in the Ebola situation, the Ebola crisis that existed there. And what you find in health systems research is that it makes no use of the wider range of systems approaches or systems methodologies, which in my view, it clearly should. So if you look at the world in terms of processes which have to be optimized in the achievement of goals, or if you look at the world in terms of interacting causal links, you're only using two possible perspectives in terms of viewing something like the Ebola epidemic. Instead, you could use a different type of systems methodology and look at the world in terms of systems which are seeking to be viable and adaptive, health systems which are seeking to be viable and adaptive in the face of turbulence, so that they can respond to problems of this kind. That's not covered in process mapping or system dynamics. Or you can see the world in terms of a multiplicity of stakeholders whom you have to bring together, whose views you have to accommodate in order that they can go forward together, agreeing upon a strategy, agreeing upon actions, feasible and desirable change in order to improve things. That is not covered in process mapping or system dynamics. Or you can see situations of this kind as ones where inequality rules. It is in countries which are less developed where this kind of outbreak takes hold and spreads. In the US, I think they had one case, and immediately everything was isolated around it. Immediately, action was able to be taken, and vaccines actually started getting made then. But it's poverty and it's inequality. I already mentioned the fact that women suffered more than men in terms of their role in these kinds of societies, and you don't capture that sort of thing with process mapping or with system dynamics. So what you have is a categorization of complexity which captures something of what the Ebola pandemic was like in West Africa. You know, you can call it a complex system, you can call it set a mess. That captures some of its characteristics. But the tools which are available in health research are extremely limited. The only ones which are used to any great extent are process mapping and system dynamics. The rest of the systems approaches which might prove useful are largely ignored in the health systems research literature and hardly used at all in practice. And there's very little work in terms of how you might use these approaches to, in combination, to address a multi-dimensional mess such as existed in West Africa with the Ebola crisis. So what conclusion we come to is that health systems research is really not up to the job as it currently stands. It categorizes this kind of problem in a reasonable way, but it responds to it in a very limited way. It doesn't make use of all the armory of systems thinking, and it certainly doesn't make use of the methodologies and how you might use them in combination to address multidimensional complexity. That's my first 15 minutes. So I hope I provoked some thought, and happy to have questions and discuss.
Wonderful. No, absolutely. Thank you for that. And while you were talking, I did put in the chat a reference to the article health systems research and critical systems thinking, the case for partnership. I did read that article a few months ago, and yes, it did resonate a lot. So wondering if there are any questions from the participants here in terms of what we heard. So key messages around, the concepts around critical systems thinking. There's a lot of different tools and approach, and it appears that we only use a limited subset of those generally when trying to address complex issues in the health system, which have, there's some technical issues, political issues, organizational issues, cultural issues, economic aspects, all of those there. So what's coming up for folks as you heard those first 15 minutes, or questions you might want to ask?
Mike, I wouldn't have really thought of process mapping as a systems approach, but I'll get on what's the sort of background.
Yeah, I think you probably should, because it stems largely from Deming's stuff, where you get all kinds of developments from Deming, such as the Toyota production system and Lean and Six Sigma, etc. And the process mapping is fundamental to a lot of those kinds of approach. And it is the use of systems ideas in a pretty mechanistic way, I would agree. But it is still nevertheless a decision about the purpose that you're seeking to achieve. How do different elements, usually people's actions, interact in achieving that purpose? And an attempt to design the process as efficiently as possible and with as much efficacy as possible to reach that goal while eliminating all waste. Now, that to me is the use of a limited set of systems ideas, but nevertheless in a pretty powerful way. And this kind of approach, I've seen it, examples of it used. I gave one example from Ebola, but there's a very nice online podcast of its use in a stroke unit, where by looking at the demand that was coming into the system, they were able to make that much more efficient and effective, incredibly more cost effective. I've seen it used in all sorts of fields, really, where it's brought benefits. So I'm not one of these people who says these kinds of systems approaches are not useful and these are. To me, efficiency and efficacy are key to trying to improve things, even though they need to be balanced with lots of other conceptions as well.
Yeah, I mean, I've had success with those approaches as well, but certainly they don't work, they don't always work in other approaches sometimes better, so
Thank you, Ivan, for that question. There's another question in the chat from Brent saying, is the educational mental model for doctors and the health system also a limiting factor for health systems? Don't know if you have any thoughts on that.
Yeah, I think it is. And I will, well, let me say now, it's something I was going to go into in the second half, but since we have a question, yeah, I mean, most of biomedical training and epidemiological training is science-based. It comes from that science tradition, and when people are looking for improvements in health systems and wanting to evaluate whether they've got improvement or not, they tend to think of the traditional scientific method. They think of, can we measure it? Is it easy to see how we've controlled this disease by less people getting the disease? And so because of that, the science that pervades that form of research, I think that spreads to those who are trying to tackle health systems more broadly, where the scientific method has much less traction, because there are things you can't measure. Improvement takes a long time. You can't measure the ability of a health system to adapt as easily as you can and to respond as easily as you can. How many patients it's treating. It's harder to measure its ability to deliver, a vaccine, for example. So, and that means that people who are working in health systems research and who are looking to systems thinking for help will tend to turn to those systems approaches which look the most scientific. And those are things like process mapping, where measuring becomes possible. Have we actually reduced the time that it takes to achieve this goal? And system dynamics, because you can build from causal loop diagrams, you can build computational models, stock and flow diagrams. That starts to look scientific as well. So I think there's an overall, the scientific approach, which is obviously key to the success of medical research, pervades into areas where it's not so applicable. And it almost persuades people that they've got to follow the same route, and they choose systems approaches which look the most like science. But the result of that is that when they're dealing with health systems more generally, or broader problems arising in health systems, they tend not to have the ear of policymakers, because policymakers don't like being confronted by huge system dynamics models that they don't understand. The alternative ways of using systems ideas that I think would bring greater traction for health systems researchers and have them listened to by policymakers in the area more fully. So I agree with the tenor of the question. It is that background which contributes to the overall form of thinking and the kinds of systems methodology which appear attractive to health systems researchers.
And maybe just to build on what you were just saying, and then I'll bring Sarah to ask her question. Somebody in the chat just said maybe it depends on the type of physician. Somebody's saying they're a geriatrician, and then they view the whole patient journey as key versus specific stops. So currently leading use of systems dynamic and modeling to address these capacity and demand issues. So it might depend on the specific area as well and how they view, but definitely need to bring in more different perspectives into it.
No, I'm absolutely clear that all these approaches have their uses, used in the right situations, and system dynamics was very important in polio. And there's been some recent studies that are using system dynamics in to look at the Malaysian health system, which I think are powerful.
Thank you. Sarah, do you want to ask your question?
Thanks. Hi, thank you very much.
Right.
I quickly read your book last night on various bits, so I'm a bit behind, but I worked in the integrated care system for the last 2 years, talent leadership and cultural improvement before that, and I'm Tavistock tradition trained, so systems like stuff. So that's my thought background. But what I've always done in the last sort of 20 years of using that is draw on all the approaches. So I just firstly wanted to make a comment that's thanking yourself and people that follow that, of making it demystifying, making things a bit more accessible. I noticed a kind of splitting and kind of, this is systems thinking and that's systems thinking and this is systems leadership, and it's really not helpful because it's creating confusion. So there's that. And then I suppose my question is, I mean, I've been doing it practically with system leaders across the area I was working in part of in the UK, and I could see that development and evolution by taking that approach. But anything that is helpful that can start them off, if you like, because I've been swimming in this for 20 years, but to continue that conversation with them, I find giving them a flavor or finding things, so finding people that already sort of think in this way and then working from there has worked. But any ideas to get this moving forward, really? Thanks.
Yeah, okay, thanks for that question. Yeah, and thanks for the initial comment. It's always been distressing to me that there was what we call paradigm wars in systems thinking, where everybody upheld their own particular tradition or favoured methodology. And to some extent, I think that's gone in the UK, but in the States, you still get people who associate systems thinking with system dynamics. Now, I've got nothing against system. That was, of course, promoted by Peter Senge, and others who, saw system dynamics as systems thinking. I've got nothing against system dynamics. Let me repeat it. That point, I think it can be extremely useful. I've seen lots of good studies using it. On your second point, I think one of the issues is that the systems leadership literature is often a bit vague, and it's hard to know. You can repeat all the things about this must be cross-departmental. We must give up there being a great man or a great woman leader. It's got to be teamwork. We've got to listen. There are all sorts of articles, you know, on systems leadership that go down that track. And I find it hard to know the difference between that stuff and organization development and those kinds of literatures. Where's the systems in it? Any good consultant, any good facilitator, any good practitioner should know those things. And it's useful to have them constantly rehearsed, and they certainly are fundamental to good systems work, but they're not systems leadership. Systems leadership has got to be a mindset change. And even talking about a mindset change becomes too vague for me, because what does that mean? And so in the second half, what I'm going to say, I'm going to try and talk about the types of mindset you need to be able to adopt in order to make use of the full range of systems methodologies. And if we can get people to see that, you know, this is not huge. A lot of people despair. They think, oh, there's too much of this stuff. You know, it's not accessible. It's confusing. Which system approach to it? If we get them to see that actually there's only a few different ways of thinking, that you can label different ways of thinking, which they can access and get to know relatively well, and that the systems methodologies available relate to those, which is what I've tried to show in the book, then it becomes much simpler to understand the whole systems tradition. And there's work you can do to get people to adopt those mindsets. And it's not woolly work, you know, it's not adopt a systems mindset, be more creative, be a better listener. It's have a look at it this way, you know, and force people into pursuing that lens, using that lens to look at the thing. And they don't have to, policymakers, decision makers don't have to know all the methodologies there, because it's not their job, but some of them will be helpful and they're easy enough to manage, but they may have to call upon expertise. But the worldviews, the mindsets relate very closely to the methodologies. You'll only use a methodology properly if you understand the mindset underpinning it. And if you understand the mindset, then you'll use the methodology. Probably said that, but if you use the methodology, that will reinforce the mindset. You'll understand how that methodology is powerful in supporting one of the mindsets that's crucial to me for being able to understand and use a set of methodologies, which is when it becomes powerful. If complexity is multidimensional, then systems thinking has to be multidimensional in order to address it. It's just a variety point, really. Thanks for those questions.
Thank you. Maybe I wonder if we could take another one for now, have you share your other 15 minutes, and then we'll continue with the other questions after. I wonder, Simona, I see you have two questions around application frameworks or priorities of intervention. Wonder if you can come up and just ask your question directly, just to make sure I understand what you're asking.
Yeah, it was just my question. It was just to understand, because this framework of application for epidemics management in developing countries is very clear. And okay, the message arrived, but I was wondering an overall indication about which are priorities also tackling with like health and the needs of the patients, even in Western countries, in connection with climate change, in connection with ecocide, in connection with some environmental dynamics that are, you know, more, because I come from an environmental sector. So I'm wondering if also the health sector could somehow tackle into these and tap into these, and, you know, be keen to find solutions, also to push on some production methodologies, you know, like if it could be used, not used, but if it could be an ally for a sort of shift, also to protect the health of the people.
I hope it can, but clearly that's going to require a rather different kind of systems approach in order to take into account that kind of factor. As I pointed out in the Ebola case, it was the mining and the deforestation and the climate change which is leading the farmers to move more into the forests cultivate their crops. These things are all interrelated, and it's how we manage that situation of interrelating factors that constitute a mess, which is important. So Simone, if you forgive me, I'll move on and try and answer your point in the second part of what I've got to say.
Thank you. Yes, I think go ahead, and we'll bring in the other questions that I'm seeing in the chat after this next part.
Okay, so this is now, so how would critical systems thinking seek to manage the kind of complexity, the set of interacting elements, including environmental, that we discussed in relation to Ebola, and I think are applicable to almost all health settings. That's where they came to the fore in my mind, because working with Lewis had brought them to the centre for my attention. I'll introduce one bit of theory at the beginning of this, and it comes from a French systems thinker called Edgar Morin. And he says that confronted with complexity, the system thinkers have tended to use two types of approach. What he calls the restricted complexity approach, and that remains within the tradition of the natural sciences, in his view. So it seeks underlying causes for what is occurring, and believes that if you can find those underlying causes, then you can do something to try and bring about a better health system or alleviate any problems that arise in the health system. So it's a belief that somehow you can produce a model which captures, for a time at least, some truth about a situation out there in the world. You can model it, and you can, on the basis of that model, engineer the world to be better, or to at least be free of its main issues. And that's called a restricted complexity approach. And that's the kind of approach that I see in one area of systems thinking called general system theory, which was looking for general systems laws underpinning systems of all kinds. And if you could understand laws underpinning a biological system, you could transfer that and understand a social system, and the same laws would hold. I think that's nonsense, because of emergent properties, and we get all the individual, personal, cultural, political, social issues which occur at the social level that don't occur at the biological level. Similarly, if you believe that system dynamics, you like large-scale models that try to capture the workings of the whole system. If you believe that kind of model, you can capture the whole system through that model, and predict and control on the basis of that model, then I think you're probably kidding yourself, because chaos theory will tell you get one variable wrong, slightly wrong, and the results of what the model shows totally different. So at the beginning of COVID in the UK, when they were playing with different epidemiological models, they didn't know how the disease spread, the virulence of the disease, whether how long whether you could catch it from if people were asymptomatic, all sorts of things to know about the virus. And so you tried to quantify something and put it in the model, but you couldn't be precise enough. So the models was predicting 50,000 dead or 2 million dead, depending upon the variables that were put into them. They were not of a lot of use. And things like agent-based modeling are similar, I think. They're just lacking the capacity to grasp the complexity of human social interaction. So Morin and myself will find the restricted complexity approach useful in certain circumstances. Process mapping is an example of it as well, in the sense that you can find sometimes a part of a system which is stable enough, and where there's agreement about what you're trying to achieve, to use a process mapping approach. System dynamics, sometimes the world stays stable enough, decision makers agree upon the purpose of the system, you can chart the core causal variables, feedback, feed-forward loops, and make use of that model. At least it can inform decision makers. But what Morin says is that you're really better off taking a general complexity approach, recognizing that in the world, there's not only complexity associated with things that exist in the world, but also cognitive complexity, whole different ways of viewing whole different ways of viewing the world. So when the expert shows their model to actual policymakers, the policymakers thinking of all kinds of other issues, political, resources, what they can get away with, what the opposition's going to be. They've got all those range of issues to deal with, which are ignored by the restricted complexity approach. So what Moran says is that you need to give up the search for sort of universal approach and universal truths and prediction and control, and operate with sets of partial truths. So you're giving up the idea that you can model reality, create a mirror of reality, and instead you're saying, well, here's a set of partial truths, all of which are useful in certain circumstances. And you've just got to work out which of these partial truths is most useful in a particular context in which you're operating in. It's a much more, the background to that is pragmatism. You're saying which is going to, you're not saying which is accurately captures the nature of reality, because with complexity you can't do that. You're saying which of these approaches is going to be most useful in the circumstances which I'm facing in this situation. So what I did, and this is where critical systems thinking I think is original, is that it went into philosophy and social theory and organization theory, and it asked what partial truths, we've got to operate with partial truths, what partial truths have proven useful to the human species in interacting with the natural world and in creating societies in the way that we have managed to create them over time. So these are truths which not universal, but they've proven useful to us as a human species in thinking about the world and acting in the world. And I looked at Pepper's world hypotheses, looking at philosophical traditions which have proven useful, sociological paradigms of Gareth Morgan's metaphors of organization. What ways of looking at the world have proven useful to the human species? And in my view, you come up with 5. There can be others, of course there can, but these, you go to literature, so do the literature, and I'll stand up on the research that I've done here, then do the literature search, and 5 come to the fore. First is this mechanical way of looking at the world, which is what goal are we seeking to achieve and how can we achieve that goal efficiently? Efficacy and efficiency is the norm. And if we weren't good at that, how far would we have got as a human species? It underpins the rationality that exists in the world. We can't do without it, although it can become too much and we can lose sight of lots of other things. Another systemic perspective, I call these things, is a mechanical systemic perspective about goal seeking, efficiency and efficacy. There's an interrelationships perspective, which looks at the relationships, the interactions between different factors. There are co-determinants of health, of course. You know, poor housing in the UK won't really address health in the UK if you don't address things like poor housing or education and so on. So there's sets of interrelationships which need teasing out. There's an organismic perspective, systemic perspective, which proven useful over time, and that's looking at the world in terms of living systems, systems which have functional elements which support them in existence, which must be working well if they're going to survive, and enable them to adapt and to change and to be resilient over time. And what more do you want of a health system that's resilient so that it can, capable of anti-fragility in Taleb's terms, after it's been hit by some sort of external disturbance. And a fourth systemic perspective is what Pepper calls contextualism, which is the act in its context. And this is the different interpretations of a situation that different stakeholders bring to a situation. And you're having to cope with all different interpretations of the world, what you're trying to achieve, how you might achieve that. And you've got to work to bring these different worldviews together. But they mustn't congeal to the extent that you get groupthink. If you look at the first House of Commons report on COVID and Baroness Hallett's first module on COVID from the COVID inquiry, there's a lot of emphasis upon the groupthink that came from the government's advisory body, SAGE, relying upon the epidemiological models, believing that you could bring out different ways of holding the virus at bay on the basis of how things were developing according to the model. It proved to be absolutely wrong, but that's what was felt. And Hallett and House of Commons reports, they say this was due to groupthink. There wasn't enough challenge, there wasn't enough structured challenge, there wasn't enough red team thinking, alternative ways of thinking about these things. If there's an avalanche coming, you don't refine the mathematics and the statistics governing that avalanche. You take quick action to get out of the way. And then the fifth systemic perspective I call the societal environmental, which is looking at how systems can disadvantage certain stakeholders and impact the environment or other species in a way which is not beneficial to them or to the human species, which has to be on the same planet with them. Now, those are, I think, powerful ways of viewing the world, 5 systemic perspectives. And I think that if you bring those perspectives to bear in any health crisis, then you've got a better way of seeking to manage it. Now, it so happens that there are 5 types of systems methodology. You might think I'm cheating here, but it's right. There are 5 types of systems methodology which correspond to those 5 different worldviews. I don't think it's surprising, because if these worldviews have proven useful to the human species, it's not surprising we've invented 5 ways of acting systemically, which will enable us to do those things better. So, according to the mechanical perspective, there are approaches such as process mapping and systems engineering, integrating various processes together, highly useful. The Labour government in the UK is a mission-driven government. It wants to rely upon the kind of systems engineering methodology that put a man on the moon to try and tackle other forms of problems. To the interrelationships perspective, there's system dynamics, as we've seen, highly useful in a lot of contexts. If you can work with decision makers so that they understand the models, that they'll implement the outcomes. Corresponding to the organismic model, there is socio-technical systems thinking. It went through all kinds of developments, but socio-technical thinking at its best is essentially an organismic model. And the Stafford-Beers viable system model, how any viable system must be constructed if it's going to be adaptable and viable and effective in the face of turbulent environments. Corresponding to the purposeful systems perspective or contextualism is the soft systems approach, which in the States was championed by people like Churchman and Akoff, and in the UK by Peter Checkland with his soft systems methodology. And here is a means of trying to capture the situation, people's views of the situation, and lead them through a process of learning to an accommodation about what action to take. And also strategic assumption surfacing and testing and red teaming to challenge any groupthink or congealed worldviews. And in terms of the societal environmental perspective, then there's an approach called critical systems heuristics, which asks you to consider where you're drawing the boundaries in any particular systems, design, so that you may be drawing the boundaries to exclude certain stakeholders, or to exclude other species, or to exclude the environment. And it gives you a way of determining what boundaries you're drawing and how alternatives might be considered. So critical systems thinking is multi-perspectival. It doesn't try to get an accurate picture of the world, a scientific picture of the world. It operates pragmatically with useful worldviews. Systemic perspectives, 5 in number, will give you a good starting point, and the methodologies which are appropriate. So if you look at a health system and you think, well, you know, how's it doing in terms of its ability to adapt? What's its relationship between the centre and the parts? Because in the UK, under COVID, it was far too centralised. Then you've got a model in the viable system model that can address that kind of issue, and so on. If if the health system is not dealing with inequality, then you've got a systems approach that will enable you to start to point that out and to address that kind of issue. So to bring it to a conclusion, if you think about COVID-19, and let me go with the UK, a lot of reliance initially on a restricted complexity view using epidemiological models, which broke down. Of course, science in the end solved the issue, but the pandemic, the way it developed, was all dependent upon the way government, stakeholders, experts, the communities, etc., reacted to it. If you had taken the critical systems approach in preparing for COVID-19, you'd have paid attention to things like the state of the resources in the health service, looking at them through the mechanical systems perspective. You'd have paid attention to organizational matters, such as centralization or decentralization, and communication between the center and the parts. You'd have paid attention to interrelationships, the prime example being between social care, getting people out of hospitals, and the NHS. You'd have paid attention to issues of groupthink. Women weren't represented in decision-making very much during the time that SAGE and the expert view was dominant and the epidemiological view was dominant. And how could you have gone in to a pandemic of that kind, not having given prior consideration to how it would impact disadvantaged communities, whether that's Black or minority ethnic or disabled communities? Using a critical systems approach, you could not have gone in unprepared for that kind of consequence. But it seems as though the UK government effectively did. It didn't give consideration to that kind of thing. So my argument is for this multi-perspectival, multi-dimensional approach, multi-methodological approach, using a full range of systems methodologies and finding ways to use them in combination to address multi-dimensional complexity. And that's what critical systems thinking has been working at. Thank you.
Thank you for that. I think just kind of, demonstrating all the different ways that we can approach these issues. There's a first question I'd like to bring, and then I'll go through the ones that were asked earlier. So it's difficult to suggest a managed inexactitude in the medical profession, which has been developed around a culture of exactness. So how do you work with shades of gray when the culture receptors work in black and white, is one of the first questions.
It's very, very difficult. And of course, 98% of the funding goes into research of a quantitative nature because people like measurements and evaluations and checks, which they can see they've got value for their money. We're operating in the realm where that kind of evaluation is simply not applicable. So, for example, a lot of countries have struggled when they've been given grants by the Gates Foundation or whatever to eradicate a particular disease, and it takes them away from building up the infrastructure of their health system. They're misdirected in a sense. So the vaccine works for a period of time, but they then lose any capacity to deliver the vaccine or whatever they're seeking to do. They're distracted from the main point of developing a resilient, strong health system. So we've got to change the way that research on broader health system issues is evaluated. And you have to evaluate it, and I'd come back to the 5 perspectives. Has it made the health system more efficient and efficacious? Has it considered the range of interrelationships involved? Has it made it more resilient and adaptive? Do the stakeholders have greater mutual understanding on the basis of true understanding, not groupthink? And are we dealing with the inequalities involved and taking the environment into account? We have to somehow get people to think more broadly about evaluation in terms of those 5 systemic perspectives. Otherwise, and if they can't make that leap, then it's really difficult.
No, and maybe I know we have about just 5 minutes left. Another question that I'll maybe just paraphrase is what have you found successful in your experience in practice to move people from these more narrow views to having them see all these different perspectives? What has been most effective for you in opening that possibility to even engage in these conversations?
It's not difficult in certain circumstances that you can set up in a seminar situation with role playing and the rest of it. You can ask people to view the world through these 5 perspectives, if you like, and you have to keep them within each of the perspectives, because remember, they're all partial. So any combination, you lose something of one of them. Integrating these perspectives is not right. It's not feasible in my view. You lose something from one of them. So you have to get them to try and rigidly stay within each of the perspectives. Then they learn that they can find out something new from each of those perspectives. And they also learn that they have different explanations for what's going on. So they start to recognize the power of those different perspectives. I take the point that it's very easy, I have no problem convincing people of the power of this, but then they go back into the working environment and the thing seems to disappear. It's not just, there are all kinds of issues surrounding this. There's the dominance of the mechanistic worldview into which we're educated, and the dominance of the scientific perspective. There's the lack of education in systems thinking and transdisciplinary work. There's organizations which work in hierarchically and as silos. There's political resistances. So I don't disagree, it's difficult, but we have to do it. There is no alternative. If we continue down this track of privileging and prioritizing the mechanistic reductionist worldview, then we will not solve health problems, nor we will solve climate change or poverty or any of the other major issues that the world faces. It requires a systemic rethinking of the way that we look at it. And you can't just, as I was saying earlier, you can't just tell people to think systemically. You've got to give them some real ways of looking at the world in an alternative manner. And at least I've tried to pin down what those are and say, look, try this, try this, try this, try this. Get to grips with it. Live it. Live looking at the world that way. Not easy, but it's the only hope.
No, thank you very much. And I think I'll leave it to that as the last question. And maybe just to wrap this up, again, thank you, Dr. Jackson, for your time today and sharing your insights. For all the participants, I would highly recommend, if you want to continue deeping into this, reading the article that was referenced in the chat, reading the book, but also keep joining this Systems Innovation Healthcare Hub, because as Dr. Jackson said, this work is hard, and we're trying to build a community where we can support each other, brainstorm ways to have the conversations, share our best practices, lessons learned. Thank you for those in the chat who've added some of your knowledge or perspectives in here. We'll try to keep track of those and continue the conversation, but it is hard work, but we need to keep bringing it up. So thank you for these messages and connecting it. And yes, let's stay in touch.
Thank you for your attention. Thank you very much.
Have a good rest of the day, everyone.
Thank you.